this event. And on behalf of St. Louis University and the Water Institute, I want to thank all of you for joining us for today's webinar, The Role of Water During COVID-19. This webinar is the first in a new monthly series hosted by the Water Institute, which will serve as a platform to bring together experts, water professionals, and members of our communities to engage in conversations regarding complex water-related topics. The Water Institute, water actually being an acronym for Water Access, Technology, Environment, and Resources, is a newly established center at St. Louis University focusing on multidisciplinary research to advance water innovation to serve humanity. To learn more about the Water Institute and future webinars and other ways you can get involved, please be sure to visit slu.edu/water. So before we begin, a couple of quick announcements. As we mentioned in the email and the link to the webinar, if you have any technical issues throughout, please be sure to email alumni@slu.edu. We will be monitoring that account throughout the program and we'll do our best to help address any technical issues that might come up for you. Additionally, we will have some time at the end of the webinar for audience questions. So if you have any, please be sure to use the chat feature and indicate if it's for a specific speaker. And if you're willing to have your own information shared with your question, if we're able to get to it, please go ahead and include your name, your company or organization, and your grad year if you happen to be a SLU alum. All right, so we'll go ahead and get started with today's panel. Today's webinar brings together 3 regional experts to discuss the role of water in pandemic response in 3 different areas: public health science and practice, U.S. municipal water utilities, and community-based international nonprofit initiatives in water, sanitation, and hygiene. Each panelist will provide introductory remarks about their area of expertise, and then we'll have a discussion and some time for audience questions at the end. So now it is my pleasure to introduce the first panelist of today's webinar, Dr. Roger Lewis. Professor Lewis has taught with the faculty of the St. Louis University College for Public Health and Social Justice for 26 years. He is a board-certified industrial hygienist with more than 25 years of experience in industry and consulting in areas of occupational and environmental health hazards. He also advises students interested in global health and has worked for several years with a community-based program in the Dominican Republic to conduct disease surveillance related to children's health and diarrheal disease prevention. He holds a master's degree in industrial hygiene from Central Missouri State University and a Ph.D. in environmental health science from Johns Hopkins University. Dr. Lewis, thanks so much for being here with us today.
Thank you, Rachel. So today we're going to talk about a number of different issues, as Rachel has described, and we'll begin with my talk on global water issues in the age of COVID-19, a public health perspective. It's not just about the virus, which is really an environmental scientist perspective on how emerging infectious diseases get going. We're going to be discussing in this short talk of mine the major diseases in the world and their causes, which are primarily man-made causes. We're going to gain a historical perspective on many of these diseases, and we're going to learn about, or you're going to learn about, see, I'm a professor, so I always talk in the first person here. You're going to learn about ecosystems and how people interact, which produces something I call viral chatter, and something that other scientists have called viral chatter for some time. We will talk about common factors that drive both emerging diseases, such as the coronavirus and persistent diarrheal disease. And from this, you'll all learn about a concept called One Health and how to conduct surveillance for emerging viruses that can be beneficial as an outcome of that concept. You'll also learn about climate change and how that can drive newly emerging diseases and epidemics such as what we're experiencing now. So looking at this graphic, you can see the leading causes of death in the world. The usual suspects, cardiovascular diseases and cancers, are number 1 and 2 respectively. Not far behind, though, are respiratory diseases. Now, we know that respiratory infections are part of respiratory diseases, but of course, not all respiratory diseases are from infections, such as a coronavirus. But if you look further down, you'll see that the number 5 and number 8 types of diseases are lower respiratory infections and diarrheal diseases. Now, we have made great strides against both of these in the developed countries, but progress in the developing world lags far behind. So some historical perspective on major epidemics. You're looking at a photo of John Snow around the mid-19th century, so around 1850. John Snow is what we call the father of epidemiology. In order to determine what was causing an outbreak of cholera in London, he mapped cases of where the outbreak was occurring, and most of the cases were occurring at a broken sewage cistern in London. He took the handle off a nearby water pump, which was an intervention to intervene in the epidemic. This is similar to what putting a mask on today with the COVID virus is, stopping a problem at the source. Now, when you look at these kinds of diseases and these epidemics, what they all have in common is travel. Travel from whether it was on foot, on horseback, on ship, or airplanes today. Travel is common among all of these epidemics. But there's other factors that are also important that contribute to these kinds of epidemics and pandemics. Mass migration, exploration, world wars, urbanization, and housing are related to these. Note that these are all man-made causes driven by individual and societal security, finances, liberty, as well as power. So emerging pathogens like the coronavirus are zoonotic in origin, which means they come from animals. How does this emergence occur? Well, we think of this in terms of stages, where the first stage is with the viruses, as you can see in this picture. And the second stage is where vectors, commonly insects, can carry these viruses to wild animals or to domestic livestock. Now, animals often have, especially those in the wild, sort of a plastic immune system, which means they can accept many different viruses that people don't ordinarily accept. We have a more hardened immune system. Theirs are more plastic. So it's possible for wild animals to carry many different kinds of viruses. So stage 1 is when the viruses are accepted by animals. Stage 2 is when there is a slight possibility that some of these viruses are picked up by humans. And that can occur in a number of ways, whether it's a wet market in Wuhan or whether or not it's a farmer working on a pig duck rice type farm. Then, of course, stage 3 might be amplification or human to human transmission. And beyond that, global spread through travel. What are these threats to global health? The air and water infection diseases that I've been talking about. And what is on the horizon? What we talked about previously was viral chatter. These stages that I described in the previous slide, these stages 1 through 3, are what we call viral chatter. And we can use this concept of viral chatter as well as a concept of doing a microbial impact statement to understand how to recognize when there is something on the horizon that could cause viruses to emerge and then transfer to animals and people. What are these things that may cause this? What are these signals of viral chatter? They include globalization, habitat destruction, which is what you see in this slide here. Notice how Haiti and the Dominican Republic look so different. That's because Haiti has been stripped of all of its trees and vegetation over hundreds of years, and the Dominican Republic on the other side, which is green, still has its trees and vegetation. This habitat destruction can cause emergence of infectious diseases, along with urbanization, crowding and poor housing, agricultural practices that put people in contact with farm animals and water, and sanitation. Poor sanitation is really what I mean that can contribute to these kinds of emerging infectious diseases. All of these are signals or viral chatter. So one of our speakers today will be talking about diarrheal disease prevention through WASH. So I will be very brief here. WASH is essentially water, hygiene, and sanitation. But there's more to this to prevent diarrheal disease than just WASH. And that is we need access to potable drinking water, clean sanitary drinking water, not just access to water. We need affordable housing and good housing. Of course, sanitation and hygiene are key, but we also know that behavioral factors, how people's culture, people's acceptance of making changes to their behavior can drive diarrheal disease. Nutrition, immunity to disease or not, and people's personal financial resources. All of these are important in preventing diarrheal disease in addition to WASH. Now, if you think about those things that cause diarrheal disease prevention, and we use the acronym WASH and other factors to remind ourselves of how to prevent diarrheal disease, think now about the COVID-19 virus and other novel viruses. They also have similar dynamics to diarrheal disease prevention, similar. So it's more than just access to air to prevent the COVID virus from spreading. We need enough air, as you've probably heard about now indoors, to dilute the concentration of the virus indoors so people don't get sick. We need appropriate housing. Large number of cases of the coronavirus can occur from crowded living conditions. We need sanitation, a need for surface disinfection to remove the virus. We need hygiene. Frequent hand washing is key. Behavioral factors such as social distancing and sheltering is important. Of course, nutrition is. We don't know a lot about the immunity to this disease, but we know it's unknown, also unknown in both water and now from COVID-19. And we also know that personal financial resources is key to prevention of diarrheal disease and coronaviruses. Wealthy people tend not to be the ones dying from the coronavirus or diarrheal diseases. When we consider our environment and the importance of environment in understanding the emergence of infectious diseases, we have to recognize the importance of climate change and One Health as concepts to better understand how to prevent diseases such as diarrheal disease and airborne infections. So how does climate change inform our understanding of water resources and pandemic preparedness? Well, we know that without adequate water, which can occur due to droughts from climate change, sanitation may become impossible, contributing to coronavirus spread and diarrheal disease prevention. And diarrheal diseases. The concept of One Health is essentially a concept that identifies threats to animals, plants, and human health as integrated systems. What we understand about the One Health concept is that the health of animals is key to the health of humans. So if we do biosurveillance on both wild animals and domestic animals to see what kind of viral load they carry and make sure that those populations are healthy along with human health, then we can provide better ways to stop the emergence of infectious diseases. That's really what One Health is about. So how do we turn the corner on these emerging infectious diseases, such as whether it's Ebola, whether it's the coronavirus, whether it's persistent diarrheal diseases, cholera epidemics that seem to come up now and then? Well, what we need to do is surveillance, needed at all times, biosurveillance, looking at ways to evaluate in many parts of the world what's going on with the viral load in a number of different circumstances. We could do this by monitoring drinking water and wastewater plants that I know Mr. Skouby might talk about. We might want to monitor our well water around the world, determine what the current practices are and what research could be done using surveillance to make sure that people are drinking safe water from wells. We need to look at surveillance from sort of a multimodal point of view, thinking about how viral chatter takes place, these 3 or more stages where viruses come into contact with people and then people spread it from person to person. We could do that through using what I call a microbial impact statement, which is whenever things take place like new construction, new mining, new agricultural practices, new kinds of worldwide migration and refugees, these are all signals that viruses may be on the move. And we could use GIS, epidemiology, and remote sensing to evaluate these problems and provide some solutions. So in summary, what we've been talking about is how ecosystems and people interact to bring about emerging infectious diseases. Some of the same concerns we have with global water and WASH are shared with the spread of coronaviruses and other emerging infectious diseases. We also have to recognize the role of climate change in emerging diseases and how the One Health concept can help us understand how to conduct surveillance for these diseases in the future. Surveillance, such as decentralized biosurveillance, which is discussed in a recent article, I think, that appeared in Science, is needed to produce global microbial impact statements so that we can evaluate agricultural practices, food processing, mining, construction, housing, urbanization, and more. Thank you.
Great, thank you so much, Dr. Lewis. Our next panelist is Curt Skouby, the Director of Public Utilities for the City of St. Louis. Mr. Skouby has over 30 years of experience with the drinking water industry and is an active leader and volunteer in the American Water Works, the State of Missouri Safe Drinking Water Commission, the Partnership for Safe Drinking Water, and the Metro Water Infrastructure Partnership. Mr. Skouby is a registered professional engineer with the state of Missouri, holding bachelor's and master's of science degrees in civil engineering from the University of Missouri. We're so grateful to have you here with us today, Mr. Skouby. And with that, I will hand it over to you.
Well, thank you. I appreciate you having me here today. I'm going to talk a little bit about where our water comes from. It'll be largely from my perspective here working for the city of St. Louis, but what I say really applies for all utilities across the country. That just maybe their story is a little bit different, but it's just a variation. I'm also going to speak about how the pandemic with the virus has impacted us. We had some challenges. I am happy to say that one of them is not having the virus transmissible through your drinking water. That's not going to be a route of infection. So I'm very pleased with that. Drinking water in the United States is reliable and safe to a large degree. It's a collaborative effort of many different groups and people involved to make it happen. And it's just not the utility that makes it happen. The effort made up of the partnerships, it starts with US EPA and the related state departments that oversee the drinking water. You have the health departments, you have researchers in universities and other places, manufacturers, suppliers, and contractors that help make it happen. And lastly, and importantly, it is the end customer that has a significant role in providing safe water and keeping it safe. This is an image of our Howard Bend plant on the Missouri River. Next slide, please. As a service provider, what we do is take the water from the source and treat it to the standards set by the federal government and the state. It is quite often we don't just the goal is not to just meet the standards, but to exceed them, to make the water as good as we possibly can. In the image here to the left is the Missouri River that is known for a lot of sediment in it, and on the right jar there is our finished water. So it takes a lot of effort to make it happen. Next slide, please. The treatment process is an involved process that we try to accomplish many different things simultaneously as the water moves through the plant and is treated. Some of the things that we do is remove the particles, as you saw on the last slide. We remove chemical contaminations, try to prevent at least taste and odors in the water. We soften it, since our water is considered hard. Corrosion control is all important so that once the water leaves the plants and goes out in the distribution system and more importantly into the customer's plumbing, that it is not corrosive. We disinfect to kill microorganisms that might be causing diseases should we ingest them. Many utilities practice fluoridation of their water for prevention of cavities. And then most utilities, particularly the surface water, will have a filtration step to polish the water off before it's sent out to the system. These processes, while they're occurring simultaneously, they also can be a challenge to keep everything in balance, because some processes work against the other processes in treatment. You don't want to end up with a disinfectant byproduct from the chemicals, the disinfectants that you're adding. So it can be a challenge at times, particularly as your source water changes with the weather. Next slide. Once the water leaves the plant, it goes out in our distribution system where it is continues to be monitored and managed so that the water quality remains in good shape. We look at the disinfectant residual. That'll be a sign if we have maybe some contamination or if the water's aging out in the system and we need to do some flushing to change over the water and keep it fresh and also in good shape. Next slide, please. Finally, the water reaches the customer where enters the premises plumbing. It becomes under the control and oversight of the customer. Even with that said, the utilities and various regulations still have oversight and responsibilities connected with it. Next slide, please. Once the water is in the building, is subject to these changes of oversight and control. The customer may want to further treat the water, like put it through a softening machine, ice machine. Most people want hot water. That has an effect on water quality. The heating of the water can cause dissolved minerals in the water to precipitate out, forming scales inside of the hot water tank or the hot water pipes. The point is it undergoes further changes, some deliberate and some as a byproduct of what the customer is doing. Additional regulations and standard applied as it comes under the plumbing as part of the plumbing code. These are all designed to keep the water safe and to be consumed by our customers. The property owner has a critical role in the oversight of the water by making sure that any changes in their plumbing is done according to the plumbing code, and that the various water systems are maintained and kept functional as they're intended. Next slide, please. The COVID-19 responses. This is, while it's not an issue as being transmitted in the water, it has affected us. The water that we provide to the customer is critical that we continues to get to the customers as they're staying home for various reasons, either quarantine, stay-at-home orders, or working from home. We need to get the water to them, and it can't be compromised by it. Utilities and their suppliers and contractors have had to come into work, and they can't stay at home and still operate the plant. They need to come in and do their job. This is where a large part of the challenge has been, is having employees at work to keep them safe, keep the customer safe from being infected with the virus, but yet achieve our missions and perform our duties. We've had to do numerous changes in how we do things. We've had to spread out people while they're at work. We can either do that physically by providing the separation while at work, or shifting times when people are here, so that you have one crew comes in at a certain time, and then the other half comes in at a different schedule, so that you don't have as many people in the same location at the same time. We have had to have most of our employees come into work every day throughout the pandemic. We have also discontinued, like most utilities, discontinued shutting off customers for non-payment of their water bill. While the pandemic has gone on, many buildings have sat empty for weeks or even months. This presents a problem when they go to reoccupy these buildings. The owners or managers of these buildings need to go through and systematically flush their lines and service their connected water apertures to, like, the softening unit or ice machines, to make sure that the people that are coming in have safe water to drink. As water has sat in the plumbing of the building that's been unoccupied for weeks or months, they have, this water has lost its chlorine residual. This could allow for the growth of bacteria, some of which are pretty serious potentially. If you have Legionnaires, for example, in the plumbing, it would have a chance to grow and become an issue. So you want to flush that water out. You also have, during this time, the extended time in the water has had time to interact with the plumbing and leach out from the plumbing contaminants that might reach a harmful level. Whereas during normal operation time, the changeover water, you may not even measure the contaminant, but after it's sat in the building for a month or two, you may have a health level of a contaminant like lead or even copper or some other corrosion product that would be a level that would be an issue. The CDC and EPA has some very good guidelines for opening up a building and how a property owner or manager can go through and systematically flush their building and service their ice machines, their heating, their water heaters, and other apertures of their plumbing. With that, I turn it back over to Rachel. Thank you.
Great. Thank you so much, Mr. Skouby, for giving us that perspective from local water utilities here in the States. And next we'll turn and look at an international perspective in communities around the globe. So I would like to introduce our next panelist, Shilpa Alva. So Shilpa is the founder and executive director of Surge for Water, a nonprofit organization that helps address the cycle of poverty in communities across the globe with sustainable water, sanitation, and hygiene initiatives using a women-centered, community-driven model. Ms. Alva has over 17 years of experience focused on supply chain, business transformation, international development, and nonprofit management. She holds a bachelor's degree in chemical engineering from Johns Hopkins University and a master's in business administration from the University of Minnesota's Carlson School of Business. Ms. Alva founded Surge for Water in 2008, which has since served over 1 million people in 11 countries around the globe. We will now hear from Ms. Alva, beginning with a short video from Surge for Water.
For 11 years, Surge for Water has been providing vulnerable communities around the world with access to some of life's most essential needs, such as water, sanitation, and hygiene solutions. Now more than ever, water and soap save lives, yet 3 billion people don't have a way to wash their hands at home. But we're out to make a difference. Right now, our teams are installing critical hand washing stations. These aren't only going in homes, but also in hospitals and markets, helping people stay safe where it matters most. Through our partners, we're producing and distributing soap and even teaching communities how to make their own. We're also making cloth masks and educating on COVID-19 prevention, including how to wash hands properly. But while Surge is on the ground taking action in our global communities, we also stand with each of you in our deeply connected world. As we care for the weakest among us, we know that we are stronger together. Access to fresh, clean water continues to be a life-changing source for hope and joy.
Hi, everyone. Thanks so much for having me, Rachel. And I'm glad to be here to share the global perspective on how Surge for Water has been working in remote communities around the world, not just in response to COVID. We've adapted our program with COVID, but really we've been doing this work for 11 years. So on the next slide, we have some of the statistics. When you talk about the global water and sanitation crisis, it's pretty severe, right? You're looking at a situation where right now, in like all the advancements we have in technology, there are still like over 2 billion people who lack safe water in their homes. And there's over 4 billion people who lack adequate sanitation. And now in the context of COVID, when you're looking at like hand washing being so important, there's an astounding 3 billion people who lack access to this basic need, right? So the issue is so significant, with people dying today, like 1 million people dying every year due to a lack of something that's completely preventable. So it's really nice, you know, when Curt was sharing the information on utilities, I'm like, this is incredible, right? Because we're working in situations where there's no such thing as a public utility, where there's, you know, there's no piped water, there are no flushable toilets. It's rural areas where the water source is very similar to this well. And of course the governments are involved, but it's just a very different solution. So just interested to share that with you today. So as we move on, just very quickly, since we are a smaller organization doing great work, but most of you wouldn't have heard of us probably prior to today, that it is our mission to work on water, sanitation, and hygiene solutions, understanding that with access to water, entire communities are transformed, right? It leads to improvements in education, income, health, just overall well-being, and a chance at a better future. So the next slide, please, Rachel. We're currently working in 4 countries. We've done work in 11. And as you heard in the video, we've impacted over 1 million people. But we decided, 5-6 years ago, that we were going to go focused on a few countries and really look at WASH. And Roger shared that earlier, but basically when you look at WASH, right, it's water, sanitation, and hygiene solutions. And the way we approach it is we implement these solutions in households, so providing community sources. Schools are a big area, like a gathering point, as well as health centers. And we do these, I love seeing the image earlier of the border between Dominican Republic and Haiti, because we work in both countries, and I've traveled that border several times, and you see that the difference in the environment quite significantly, just almost as immediately as you drive over, and then also the consequences it has on water, sanitation, and hygiene. When we talk about, in the next slide, when we talk about Surge's work, And I spoke about the 4 different ways, but the 4 different things, 3 different things we do. I also want to add that we work on menstrual health. That's a core piece. Won't be speaking much about it today because the focus is water. But just want you to know that that's something that we're also doing as part of our initiatives in the communities. And something that makes us unique and that's really important, has become even more important in the time of COVID, is the model that we have. Because when we look at when our work is implemented in these countries, it is completely community driven. It's grassroots, driven by the community. You know, I already started seeing some questions in the chat about like cost effective, low cost solutions. And really everything that we do is low cost. Like you're talking about things like our filtration is our biosand filters or like locally produced clay filters, right? Like age-old technologies that are really simple, low technology, affordable, and things that can be produced locally. And this, by working with the local community and working with local solutions, we're really able to ensure the sustainability of a program, you know, when you don't have access to, you know, high-tech innovation. So moving on. Just to share that in addition to the 1 million people we reach, something that's really important are the jobs created and kind of this, like in this process. And, you know, right now, like public utilities, like we just heard that all the employees have had to go to work. And I think it's important, you know, for us to realize that around the world, providing water, sanitation, hygiene has like a whole labor force behind it. And it's important to know that they are really also frontline heroes in this response against COVID. Moving on, talking specifically about, you know, the issue and like how we're impacted and how we've sort of adapted as an organization in these changing times. You know, this is reality. Like I was at, this is a water source in Kabramaito, Uganda. And prior to constructing a new water source, a new borehole in this situation, the school, Olelai Primary School, the children would walk quite a distance, I want to say like 30 minutes away from their school to this open spring. And this was the primary water source. So now you take an additional complexity. So this is already a horrible situation, right? And now you have this additional complexity of the fact that there's a pandemic and you're supposed to be using clean water and soap, potable water, right? And then if this is the water source and we would test these water sources and you're looking at like significantly high percentages of E. coli. And so I just want to give you more color into like the kinds of sources and issues that we deal with in our communities on a daily basis. And the next slide, you know, really starts moving us towards like, yep, we understand. All of us know today, right? We've all heard all of the messaging out there from the CDC, but also just anyone who's on any sort of social media or like, you know, you hear about water and soap being the most important way to save lives. But how do you handle that most important way to save lives being water and soap when 3 billion people in the world still don't have a way to do that in their homes? So at Surge, you move on to the next slide, Rachel. One of the things that we did is, in addition to our core programming team, in about April, so the end of March, early April, we decided that, you know, we would kind of pivot away from focusing more heavily on infrastructure solutions. So yes, we're doing the wells and the toilets, but we're doing that a little bit slower right now. And this is a picture from Haiti. And we hired, just for an example, in Haiti, we hired 17 new hygiene promoters in April to basically go door to door. So these individuals, I think you can see the megaphones in some of their hands, they are going door to door and they're raising awareness about, you know, first of all, what is COVID-19, right? A lot of people, there's no access to internet, cell phone coverage is pretty, I guess, risky. You're not always getting connectivity. So we're trying to think about like effective ways to spread the message, and we needed manpower because this particular picture is from an urban community called Cité Soleil, but we also work up in the mountains in really vast rural communities. So a lot of interventions of like raising awareness through bodies and people is very important. And if you move on, when we talk about addressing, you know, okay, I've already mentioned that they don't have, in our communities, piped water and access to water in your homes is pretty unlikely. So what we decided to do is This is right in front of a well. So the wells are the background of a water source that we would have fixed or drilled. And this is a low-cost solution. This is a hand washing station that the Water User Committee has now installed with our help. And someone from the Water User Committee, I think this woman actually is the chairperson of her Water User Committee, makes sure that there's water and soap in there so that anytime someone goes, and I remember too, when you're going to get water, it's a manual pump. So they're using a pump with their hands that could be dirty. So they've started enforcing that people are going to have to wash their hands before they place their hands on the pump. And of course, they have to provide a way for people to wash their hands if they want that to happen. So this is a community solution. And if we go on to the next slide, you saw this in the video, but I just want to spend a few more moments talking about it because the picture on the left is a market. So, you know, everybody goes to, you know, just like grocery store. If you think about how stressful grocery store shopping has been, even in the developed world, in the US during this time, right? Like, do you have your mask? Like, what should I touch? So here you have public markets. So people are still going out. Farmers are coming to these markets to sell goods. So we've installed these hand washing stations, both at the markets, but also at the health centers. In the districts we work in Uganda, for example, there are 12 health centers. None of the 12 health centers had public hand washing stations with soap prior to this pandemic. So we work with the local government to make sure that that was there. The other thing that we do is soap making classes, teaching communities how a sustainable way how to make their own soap, because if we just provide bars of soap, then you're not creating, you're not building capacity for a continued solution. So here we are teaching a hospital how to make their own soap, and we do the same again in markets and in other institutions. The other pieces, we move on, the other piece of this, which is, you know, when you talk about wash, you know, our core are like things like water and soap and hand washing, but you know, in the time of this pandemic, masks have become pretty important globally. So yeah, we switched our efforts, and like we even repurposed some of our materials and supplies and labor that would normally go towards making reusable pads into making masks as well, because of course, menstrual products are still needed at this time. And then if we move on, we had to get really creative at this time, right? So you're trying to reach, so we serve in the countries that we currently work in, we serve about 300,000 people. And even if we've hired all of these new staff members to basically go out and raise awareness, it's impossible for them to reach 300,000 people effectively and safely. So we started using radio programs in both Haiti and in Uganda to effectively send these messages. So these are like, you know, this particular one is like every week, 2 hours radio show, which definitely talks about COVID-19. So it's kind of similar to what's happening on this webinar, actually, where people can listen, but they can also call in and they can ask questions. And it's also become now a forum in these districts to talk about other societal issues that the virus has brought about. Because, you know, as mentioned earlier, you know, when Roger talked about wash situations, it's more than just access to water, sanitation, hygiene, right? There's so many other societal things that are going on, and the pandemic makes that even worse in like communities that have weak health systems and weak economic systems. And I think that's my last slide, Rachel. Can we move on? Oh, and of course, we've created customized training materials just in response to this time. So the last image there with the colorful boxes is in Haitian Creole. And it was posters that we created immediately with our field partners so that, you know, they had something to go out there as like a learning guide to like talk to the communities about. And it's like, you know, a couple of pages, and it goes through everything: what COVID is, when you should wash your hands, why wash your hands, what's physical distancing about, how do you use a mask. So these are just some of the initiatives that we've adapted to in this time. And as we go forward into, you know, the virus is changing, and there's some of our communities have had it under control. In some cases it's still growing. But we're just making sure to keep in mind, like, what do we take from the learnings of this time and allow it to come into our longer term model for the resilience of our communities, but also as an organization well beyond this time of COVID-19. Thank you.
Great. Thank you so much, Ms. Alva, for sharing your experience and expertise and for the great work that your organization is doing. So I will go ahead and bring back all of the panelists, and we'll have a bit of a discussion here and then open up to some audience questions. So if you have any questions, please remember to go ahead and put them in the chat, and we will try to get to as many as we can here in a few minutes. But I want to go ahead and start with a couple of initial discussion points. As we've all heard before, the coronavirus pandemic is in many ways an unprecedented situation. And across sectors, institutions, and organizations have had to take new or innovative approaches to address water across water access and related health issues. Are there any lessons from this experience or from other moments of crisis that could inform innovative approaches to water, sanitation, and hygiene during what we might consider more normal times? Ms. Alva, I'll go ahead and start with you for this one.
Sure. Thanks, Rachel. So yeah, definitely. I mean, just some of the things that I shared, right, about the fact like we're now using radio shows more as a way to safely and effectively communicate information. The other thing that we've been seeing is, you know, hand washing has always been important, but it's obviously become more important right now. And we're seeing a lot of really cool, like handless, like powerless technologies coming up to like how to wash hands, like things that like local communities are coming up, like with foot pedals. And like, you know, there was an image both in the video and in the presentation of a tippy tab, which is like a low cost way to wash hands. But there's other ways that we're seeing emerging. And then I've also seen the larger like institutions like the World Bank and like larger like UN agencies have been encouraging a lot of innovation. They've been specifically providing funding. A lot of foundations are doing the same. So it will be really exciting to see what comes out of the space that can be honestly solutions. Like you should never be touching a tap in a public water source if you don't need to, right? Because it would always be great that it would be touchless without the use of energy. So yeah, I'm excited that some of the learnings for now will be continued into a later time.
Great. Yeah, that's great to see some of those innovative approaches. Mr. Skouby, did you have anything you wanted to add on this?
Yeah, I think so. I think it's this is a serious pandemic, but there's other diseases that are out there that might be more serious. I think in some of the planning we did in a worst case scenario when we first were confronted, here we may have 25% of our employees out due to illness or quarantine. How do we stay functional? And I think if we have a more pervasive disease than what we are already seeing, which is bad enough, we'll be better prepared for that. So I think that's one of it. And I think some of the processes that we did internally in our organization to prevent the spread of the disease will help, like for a normal year of flu and other mundane, so to speak, common illnesses.
Great, thank you. Dr. Lewis, did you have any other thoughts?
Yes, thanks, Rachel. Well, here's the thing. I think about this pandemic as a disaster, like many other disasters, like hurricanes, like wildfires, like the many disasters from climate change. When you think about disasters, you have to consider who are the ones who are most likely to fall victim to so-called natural disasters. And it's really people with very little resources, very little financial resources, people with very little political power, often people who are in marginalized communities, people who have very little and whose parents and grandparents had very little, and therefore are mired in poverty, really no fault of their own, except that they were born into a system where they had very little opportunity to get out of poverty. These are the folks that after a natural disaster, pandemics, persistent diarrheal disease, hurricanes, wildfires, they're the ones who usually can't rebuild or die first because they don't have access to health care, or they don't have a means to put a roof over their head after a disaster, whereas wealthy people and people of means who have power and who have capital have the ability to regain their health and their wealth after disasters. So we have to think about that. we have to think about what can we learn from this disaster, this pandemic, and other disasters that we have to make more sustainable communities in the long run. Resilient communities all over the world is the goal, whether it's through appropriate water access and disinfection and waste handling and so forth, and trying to build up communities so that they have the resources to deal with these events rather than waiting for the aftermath, which is people in hospitals and emergency rooms.
Thank you for your expertise there, Dr. Lewis. So as we've been having this conversation, obviously each of you represent a different sector working in water-related fields. And as we talk about innovative approaches, new approaches, addressing these really important issues and persistent challenges, what opportunities are there for collaboration across sectors and across industries? Mr. Skouby, would you like to speak on that?
Yes, I'd be happy to. The water sector in the United States has a long history of collaboration between various health departments, the utilities, in amongst themselves, and this has been going on for a long time. We as a utility have done a number of research projects, or assisted in them more likely. We're not the ones conducting them, with various universities. SLU is one of them that we have worked with in the past, and to advance the knowledge of issues in drinking water and made real strides. We've also, as a utility, are a member of the Water Researcher Foundation, which does a lot of research or sponsors research in the water industry and drinking water to answer questions of things we don't know and emerging issues, and learn how we can better serve our customers with that. And I see this continuing on. It's important.
Great, thank you so much. Ms. Alva, did you have anything else you wanted to add there, or Dr. Lewis?
Yeah, I'd like to, sorry, do you want to go ahead, Raj?
Oh, no, go ahead, Alva.
Yeah, I'd like to add that, yeah, even critical to like all our programming in the field, you know, we have to work with the local government, local businesses, civil society organizations. So that has to happen if you want sustainable programs. I think when you ask that question, Rachel, I think about it more from a global perspective, from, you know, is there an opportunity right now? Because what I'm seeing that's happening with COVID is that countries like the United States are now so focused on like what's happening here that the global context has always been sort of like, you know, in the background, because I understand we have a lot of issues going on here in many areas, not just with COVID right now. And I just wonder how much of that across country border collaboration will be minimized because of everybody focusing on this insular sort of way. And I guess, just from where we come from in our perspective, we do see it as a global community. And when you're talking about a pandemic, Dr. Lewis shared this, it's about travel and migration. So it doesn't matter if you solve the issue here in the US, if somebody in another country travels and it still spreads. So it's like, it's so important. So I think that's what I would just say. It's not just collaboration across sector, it's collaboration across countries and corporations to support other countries and people. And like just everyone, we just have to it's beyond geography as well when you think about that.
Great, thank you. And Dr. Lewis, did you have some thoughts there as well?
Yeah, thanks. So I agree with what Curt and Alva are saying here about collaboration across, whether it's water utilities or working with small NGOs, such as what Alva belongs to with Surge. When you think about some of the things that I was talking about in my talk, such as surveillance, for when you think something might be going on, whether it's mining, agriculture, certain food practices. A paper that came out recently talked about the idea of considering biosurveillance as something that's decentralized, something that can happen in small communities, such as where the community that Surge serves. Can we find and can we come up with low-cost means of doing surveillance for antibiotic-resistant bacteria in the water, in the wastewater? Can we look for COVID-19 in the wastewater in rural communities? Can we look for that in municipal wastewater communities, such as what Curt's responsible for? Can we also look for all kinds of different types of habitat destruction that might be going on in the small communities that Alva serves that might cause emerging viruses to come around, which is what we call viral chatter. So yes, I think working at the local level and then working our way up from the local level to a broader, more municipal level, such as where Mr. Skouby works, is how we can do this.
Yeah, I have something to add if that's possible. I think there is a real need to take information and promote safe drinking water and sanitation of wastewater throughout the world, in third world countries in particular, because that also protects their health, but it protects our health too by, if the disease doesn't get a foothold someplace in the world, it could happen here in the United States, it isn't going to spread globally and happen in what we see here. I think it is. I think there's a real awareness that this needs to be done. You know, what was done in the United States over the last 100 years of sanitation, safe drinking water, and wastewater, this needs to be done globally.
Great, thank you. Does anyone else have anything to add to that discussion? Okay, great. So as we've talked about, the Water Institute is a new center focused on multidisciplinary research surrounding water. How can research impact innovative water initiatives in practice, locally or globally, especially in times of crisis or in planning for future challenges? And Dr. Lewis, as the researcher on the panel, I'll go to you first for this one.
Okay, well, I'm going to pick up a little bit where I left off with biosurveillance. So the idea that we could, instead of having large organizations like, I don't know, like the Center for Disease Control, the World Health Organizations, or others, do the work of surveillance around the world, they still need to do that. We could look into what it would take and come up with research appropriate methods to figure out how groups like SURGE could work in the developing world with low-cost detection equipment and do all kinds of evaluations using checklists of what goes on within the environment of a community and how that could affect the development of emerging infectious diseases. So I kind of see an opportunity here for us that's coming out of this to make sure that we are better prepared for pandemics instead of relying on the big, the big agencies to do everything. Work on the small level and get it done locally, and then use databases and technology like GIS and other types of technology and web platforms to send that information up from the bottom up to the top instead of top down. Just like you're aware of the Weather Underground. I'm not talking about a group of revolutionaries back in the 60s or 70s. I'm talking about people who have little amateur weather gauges in their backyard that are connected to the internet, and they report in real time the weather conditions in their backyard, and then they can upload that to a database, and NOAA, the National Oceanographic Atmospheric Administration, uses this information to find out where a tornado might come about. This is the same thing that we could do with decentralized biosurveillance, have databases that are linked to these small organizations like SURGE, and then together with groups such as the St. Louis Water District, try to combine information about what's happening with a viral load or with antibiotic-resistant bacteria that's getting into our water, or other emerging infectious issues, such as whether or not bushmeat is being eaten by people near a market, or whether or not there's bad conditions in a wet market, and things like that. That information needs to be gathered locally and then brought up.
Great, thanks so much. Ms. Alva, do you have anything that you wanted to add to this?
I was just going to say that would be incredible. Like, that would be a perfect way to use research in our work, because again, we don't have the resources. Biosurveillance would be, in a low cost, efficient way. We have people like on the ground, like that would be incredible. And actually it's amazing how little of that like low cost technology exists right now, and even just systems that are out there. So it's just, we would be happy to partner in something like that.
Great. Mr. Skouby, any other thoughts?
No, I think they're right on the money. It's there is a real opportunity here.
Great. Love to hear all these opportunities for collaboration. So hopefully that can continue after our conversation today. So unfortunately, we are out of time. I know we didn't get to all of the questions that were submitted, but we will send those to the panelists after this and see if we can get some answers back to folks about a few of the major themes that came up in those questions. So first I want to just thank all three of our panelists today for being on here. You all have been incredible speakers. I know I've learned quite a bit, so I'm sure that everyone participating here has as well. So thank you so much. And thank you, of course, to everyone who jumped on the webinar today and joined us for this. We really hope you enjoyed this first panel here with the Water Institute, and we will be following up with an email with the survey for your feedback. We'll also include some resources from our speakers today so you can learn some more information. And like I said, there's a couple themes that came up in the questions that we'll try to address in that as well. So in one other quick plug about an upcoming event in August, we'll host our next webinar with the Water Institute, and that will be focused on regional flooding. So there will be some more details available about that coming up. Again, if you would like more information about the Water Institute, any upcoming webinars or other ways to get involved, please visit slu.edu/water or email water@slu.edu. So thank you all again for joining us today. Thank you again to our panelists, and I hope you all have a great rest of your day.